practitioners and a NSC holder. The topic for this course is nursing ethics and jurisprudence, that is nursing 309. Nursing ethics and ethical issues in the practice of nursing, personal philosophy of nursing, the National Code of Ethics for Nigeria, the International Council of Nigeria Code, principles of ethics, relationship with the patient and other members of ethics, introduction to the laws and status as they affect the nursing profession and practice, Patients' Bill of Rights, Professional Negligence and Malpractice Act, legal rights, duty, liabilities, informed consent litigations, dilemmas in the practice of nursing. Now, introduction. Nursing in Nigeria has a rich history dating back to the colonial era and has evolved significantly over the years. During their early years of practice, Nigerian nurses encountered various ethical challenges. To address these issues, ethical codes and guidelines were developed over time. Over time, ethical codes and guidelines were developed to address these challenges. The Nigerian Nurses and Midwifery Council of Nigeria established a comprehensive code of conduct aiming to standardize ethical behavior among nurses in Nigeria. Additionally, Nigerian nurses adhere to International Council of Nursing Code of Ethics, which provides universal ethical principles for the profession. Ethics deal with moral values. Examples are what is good or what is bad. In other words, ethics has to do with the values placed on human behaviors or actions, whether good or bad, by society. Ethics deal more with what we should do than what we actually do. Law, on the other hand, though deals with human behavior too, is concerned with what the list of such behavior that can be accepted by society. While different ethics and law share some similarity, as can be deduced from above, both are vital to the practice of nursing as issues that has to do with patient care often involve one or the other. Legal terminologies used in ethics and law were assault, an intentional threat or an attempt intentional threat to injure or bring about harmful or offensive contact with another individual. Example, threatening to force a patient to take his medication or restraining a patient in order to give an injection. You will think you are doing the right thing as a nurse, meanwhile it's against the patient's wish. Then battery, an international touching or an intentional touching of another person without consent, with or without injury, dressing of patient's wound without consent. Bioethics, the study of ethical dilemma in healthcare. Breach, breaking the law, an obligation or the terms of a contract. Contract simply means an agreement. When you breach it, that means you are going against the law. Then civil law, a breach of law that defines the legal relationships within individuals. Code of ethics, a specific set of professional behavior and values a professional must know and abide by. Conduct, behavior of a person or a person's action. Consent, permission granted by a person voluntarily and in sound mind. Criminal law, a branch of law that defines the obligation between an individual and the state or society. Ethics, the philosophical study of right action or behavior and wrong action or behavior. Ethical dilemma, a situation in which a choice must be made between two equally desirable or undesirable actions. Forced imprisonment, making a person stay in a place against his or her wishes, e.g. isolating a patient in a ward without seeking consent. Felony, a serious crime, a crime punishable by a term of imprisonment. Fraud, a willful and purposeful misinterpretation that can cause harm to a person, e.g. giving incorrect information to obtain the patient's consent to treatment. In conclusion, adequate resources, including staffing, facilities and equipment, should be provided to enable nurses to deliver ethical care effectively. By prioritizing nursing ethics and practicing with integrity, Nigerian nurses can contribute to an improved healthcare system that values patient-centered care, respects patients' rights, and maintains professional standards.